Fenoprofen is a nonsteroidal anti-inflammatory drug and SAID with analgesic, anti-inflammatory, and antipyretic properties. Its pharmacology includes 1. Mechanism of action. Fenoprofen works by inhibiting the activity of enzymes called cyclooxygenases, COX1 and COX2, which are involved in the synthesis of prostaglandins. By reducing prostaglandin production, it helps to relieve pain, inflammation, and fever. 2. Indications. It is primarily used to treat conditions characterized by pain and inflammation, such as arthritis and musculoskeletal disorders. 3. Pharmacokinetics. Fenoprofen is usually administered orally and is rapidly absorbed from the gastrointestinal tract. Its half-life is relatively short, requiring frequent dosing. 4. Metabolism and excretion. It undergoes hepatic metabolism and is excreted in the urine, primarily as metabolites. Fenoprofen, like other nonsteroidal anti-inflammatory drugs, NSAIDs, can cause various side effects. The most common side effects associated with fenoprofen use include 1. Gastrointestinal issues. These are among the most common side effects: stomach pain or discomfort, heartburn or indigestion, nausea and vomiting, diarrhea or constipation. 2. Dizziness. Some individuals may experience dizziness or lightheadedness while taking fenoprofen. 3. Headache. Headaches can occur as a side effect of this medication. 4. Skin rash. Some people may develop skin rashes or itching as an adverse reaction. 5. Fluid retention. Fenoprofen may lead to fluid retention, resulting in swelling, particularly in the legs and ankles. 6. High blood pressure. NSAIDs like fenoprofen can cause an increase in blood pressure in some individuals. 7. Gastrointestinal ulcers and bleeding. Although less common than other gastrointestinal issues, fenoprofen can sometimes lead to more serious problems such as ulcers or bleeding in the stomach or intestines. This can be especially concerning with long-term use or in individuals with a history of stomach issues. 8. Kidney effects. NSAIDs can affect kidney function, and fenoprofen is no exception. It may lead to changes in urine output, increased thirst, or other kidney-related symptoms. 9. Liver effects. Rarely, fenoprofen can affect liver function, leading to symptoms like jaundice, yellowing of the skin and eyes. 10. Allergic reactions. Although not common, some individuals may experience allergic reactions to fenoprofen, which can include hives, difficulty breathing, or swelling of the face, lips, tongue, or throat. If any signs of an allergic reaction occur, seek immediate medical attention. Fenoprofen dosage for pain and inflammation. For adults, the typical starting dose is 200 to 400 milligrams mg. Every 4 to 6 hours is needed for pain and inflammation. The maximum daily dose should not exceed 3,000 to 100 milligrams. Fenoprofen dosage for osteoarthritis or rheumatoid arthritis. Initial doses may range from 200 to 400 milligrams every 4 to 6 hours. Maintenance doses are often lower and can vary depending on individual response. Fenoprofen, as a nonsteroidal anti-inflammatory drug and SAID, can interact with various drugs and substances. Here are some of the common drug classes and specific medications that may interact with fenoprofen. 1. Other NSAIDs. Concurrent use of multiple NSAIDs, such as ibuprofen or naproxen, can increase the risk of gastrointestinal side effects and bleeding. It's generally not recommended to take multiple NSAIDs simultaneously. 2. Anticoagulants, blood thinners. Fenoprofen can enhance the effects of anticoagulants like warfarin, increasing the risk of bleeding. Close monitoring of blood clotting times is necessary when using fenoprofen with anticoagulants. 3. Antiplatelet drugs. Combining fenoprofen with antiplatelet drugs like aspirin or clopidogrel can increase the risk of bleeding. 4. Corticosteroids. Concurrent use of corticosteroids and fenoprofen can increase the risk of gastrointestinal ulcers and bleeding. This combination should be used with caution and under medical supervision. 5. Selective serotonin reuptake inhibitors SSRIs and serotonin norepinephrine reuptake inhibitors SNRIs. There is a potential risk of bleeding when SSRIs or SNRIs are taken with fenoprofen. 6. Lithium. Fenoprofen can increase lithium levels in the blood, potentially leading to lithium toxicity. Close monitoring of lithium levels is essential if these medications are used together. 7. Methotrexate. Fenoprofen can decrease the elimination of methotrexate from the body, potentially increasing its toxicity. Combining these medications should be done cautiously and with medical supervision. 8. Diuretics. Fenoprofen may reduce the effectiveness of diuretics water pills and increase the risk of kidney problems when used concurrently. 9. ACE inhibitors and angiotensin II receptor blockers ARBs. Combining fenoprofen with these blood pressure medications may lead to reduced effectiveness in controlling blood pressure. 10. Certain antihypertensive medications. Fenoprofen may reduce the blood pressure-lowering effects of medications used to treat high blood pressure. 11. Certain anti-inflammatory biologics. When used together, fenoprofen may decrease the effectiveness of certain anti-inflammatory biologic drugs. 12. Alcohol. Consuming alcohol while taking fenoprofen can increase the risk of gastrointestinal bleeding and stomach irritation.